Hello everyone, welcome back. So today I got muscle name Tensor facia latae, which also comes under our gluteal muscles, that is superficial gluteal muscles. So let's start. So its origin point, it originates from the anterior part of the iliac crest. Okay, that is ASIS, and then insertion is IT band, that is iliotibial tract, which also connects to the lateral condyle of the tibia. Okay, so originate from the ASIS, insertion to the IT band through the which ends in lateral condyle of the tibia. So next is nerve supply. It supplied by the superior gluteal nerve, then arterial supply by the superior gluteal artery, and also that is ascending branch of the lateral circumflex femoral artery. Then actions, it flexes the hip, abducts the hip, and medially, that is internally rotates the hip, and also helps in stabilizes the pelvis, and it also stabilizes the knee through the IT band, because it inserts to the IT band, right? So it also stabilizes the knee, that is lateral part of the knee through the IT band. Okay, so next is daily activities, where it helps is by walking, by running, climbing stairs, standing on one leg, side stepping, or maintaining balance. These are all activities includes this muscles action. Okay, next is applied aspect. Applied anatomy is first one is tight tensor fascial lata. It may causes reduce in hip extension and contribute to excessive tension in the IT band. So tightness of this muscle may leads uh, reduces of the hip extension movement. Then second one is IT band tightness, that is may contribute to lateral knee pain. So tightness of iliotibial tract may lead to lateral knee pain. Then weak TFL, that is it may causes difficulty with hip flexion, abduction, and pelvic stabilization. If tightness is there, means there should be a weakness in the muscles. Okay, then fourth one is overuse, that is or the strain, that is a common with the repetitive activities such as running, cycling, may cause a pain around the outer hip. Then fifth one is IT band friction syndrome. So okay, it's a repetitive movement can causes irritation around the lateral side of the knee, because IT band presence in the lateral side of the knee, right? Because it insert this muscle insert to the lateral condyle of the tibia. So uh, when the repetitive movements in the IT band may causes irritation and may cause you the knee pain. So these are some of the applied aspect of this tensor fascial lata muscle. Next is a special test. I bought two special tests here. So these tests help in accessing the flexibility and function of these muscles and the IT band. Okay. So first one is Ober's test. Its purpose to test the tightness of the TFL and IT band. The patient position is side lying position, tested side up. Then procedure, that is stabilizes the pelvis. Okay, then extend the hip and the knee of the tested side. Okay, then allow the leg to drop into adduction movement. So observe the position of the leg. If the test is positive, the leg drops down, that is posterior to the horizontal table towards the table, towards the table. It is positive test, that is TFL or the IT band is tightened. If the test is negative, the leg remains in the line with the table or the drops anterior to the horizontal. Okay, that is a TFL or the IT band is not tight. So this is Ober's test. We mainly use this for to test the tightness of these two structures. Then is a Thomas test, that is TFL tightness. Thomas test is to its purpose to test the tightness. So patient position is should be in a supine lying near the edge of the table. Then procedure, that is patient hugs one knee towards the chest. Okay, the opposite leg hangs off the edge. Then observe the position of the hanging leg. If the test is positive, the hanging leg is abducted and extended, that is does not lie in flat. If the test is negative, the hanging leg lies on the flat on the table, so in a neutral position. Okay, these are the two special tests. Next is mnemonic, because we are done with origin point, insertion point, now supply, blood supply, actions, daily activities, and our applied aspect and special test. We are done with it, and now the mnemonic part. It is, I got some simple one, I hope. Sasha flexes and abducts medially to stabilize. That is, S stands for superior gluteal nerve, that is nerve supply, and A stands for arterial supply, that is superior gluteal artery and lateral circumflex femoral artery, and S for flexes the hip and abducts the hip, H, and A is medially rotates rotation of the hip, and S is stabilizes the hip and the knee joint. Actually, you can make your own mnemonic to remember yourself. I did this one. Okay, now we're done with everything. Let's revise it again about this muscle. So, tensor facial lata, it is a lateral side of muscle. It comes under superficial gluteal muscles. So, it originates from the you guys know, that is ASIS, anterior superior iliac spine, and also get inserted to the lateral condyle of the tibia through the iliotibial tract. Okay, so its action, we know that flexes the hip, abducts the hip, and medially rotates the hip, and also stabilizes the pelvis. Then nerve supply with the superior gluteal nerve and arterial supply by two, that is superior gluteal artery and lateral circumflex femoral artery. Then daily activities, we know that walking, running, climbing stairs, side stepping, standing in one leg, and all. So yeah, we are done with this muscle. So I completed all the superficial gluteal muscles, okay, and deep gluteal muscles remaining. I'll do in upcoming videos. We completed muscles of the hip, or right, that is iliacus muscle, psoas major muscle. Then we came to these superficial gluteal muscles, and I also completed all the four: gluteus maximus, medius, minimus, and tensor fasciae lata. So before starting our deep gluteus muscle, I just planning to take one quiz video. Whatever muscle we took till today, maybe we have to recall them, right? So I, in the next video, I create quiz questions, and you can come answer them in comment section, or I'll only answer in the video. Let's revise the muscles, and yeah, in the next video. So in the next video we are going to do quiz activity. So I hope you all join to that, and thank you for watching this video. See you in the next video.